we define and measure poverty?
A New Lens on Poverty
By Elliott and Marino.
How we define poverty. We define poverty as the lack of resources for FCSU and healthcare, which directly impacts an individual's quality of life and overall well-being. This definition encompasses basic survival needs critical to well-being.
How we want to measure poverty. Income should be measured after taxes, where one lives in their environment. Government benefits should not be included. Our measurement should be measured on the amount of resources needed for food, clothing, shelter, and utilities. Number of dependents are counted, and healthcare needs are counted as well. And this is really important because we need to be careful not to fall into the fallacy of measurement. Fallacy of measurement refers to the pitfalls that can arise when interpreting data and defining constructs in research and analysis, like relying solely on quantitative measures can overlook the multidimensional nature of poverty. Utilizing data collection methods that are poorly designed or even poorly executed, or just focusing solely on economic measurements like income. So, touching on the idea that the FCSU and healthcare can directly impact one's overall well-being, we say that we need to respect everybody's dignity. Because someone may have a roof over their head, but may live in overcrowded or even unsafe conditions, impacting their health and well-being. So Aristotle once said, dignity does not consist in possessing honors, but in the consciousness that we deserve them. So what does this mean? How does this apply to measuring and defining poverty? So we believe that Aristotle is saying that having a sense of dignity is ultimately about understanding and acknowledging one's own worth. So rather than just merely accumulating titles and or accolades. And we believe that this relates to our definition of poverty because if one has these lack of resources in healthcare, there could be diminishing feelings of dignity and self-worth. So just the idea that recognizing that poverty impacts not only material conditions, but also someone's sense of entitlement.
Why we include the concept of quality of life. Life should be enjoyed and experienced. Without FCSU, one is unable to have a sustainable life, and one needs to have these basic needs in order to have a good quality of life. Our definition, again, is the lack of resources for FCSU and healthcare, which directly impacts an individual's quality of life and overall well-being. Some criticisms to this definition can be that you are out of poverty and can still be struggling. You may have FCSU healthcare needs met and have a good quality of life, but still be struggling. We cannot define or predetermine if one is financially struggling. People have other needs and wants that they cannot meet, but they are still considered out of poverty. And also that the FCSU and healthcare are not enough to have a sustainable life, but in terms of defining poverty and measuring poverty, it's good enough in our eyes, and we totally agree with these statements that you can be out of poverty and still be struggling, and that these needs of FCSU and healthcare are not enough, but when putting together a definition and a measurement, this is the best we can do, and it's very hard to put a measure to these critical and hard values.
So we wanted to touch on the capabilities approach. So we wanted to define the capabilities approach as the resources that one has and or the abilities of an individual. Overall, the capabilities approach has key points such as emphasizing individual agency and one's personal well-being over income, metrics, and numbers. So considers like education and healthcare. Really quickly, this graph just shows the distinction between capabilities and functionings, and it also introduces the concept of agency of choice. So this aspect really just emphasizes the ability of individuals to make choices and act upon them. So capabilities approach continued. So what we don't like about this approach is that we feel that it overlooks the importance of social and economic structure that influences people's capabilities. So, for example, access to healthcare can depend heavily on systemic issues like affordability or availability of services, or even discrimination, all of which can impact quality of life. What we like about this approach is that poverty should not be seen in terms of lacking specific resources, but also in terms of capabilities to lead a fulfilling life. So, for instance, someone might have access to food but lack the capability to make healthy choices due to education or even information gaps.
So again, our definition in terms of Rector's argument, our definition is the lack of resources for FCSU and healthcare. And Rector's argument states that for most Americans, the word poverty suggests destitution and inability to provide a family with nutritious food, clothing, and reasonable shelter. So one can be in poverty but still have resources such as a Xbox and a fridge. But even though one may have these items, it may not necessarily mean that they're out of poverty and that they're not struggling. So Rector's argument is, why are we focusing on individuals who have these resources but are not using them in an appropriate way? So absolutely there are people that have to pick and choose which types of resources they're going to have in their lives, but it's very important that they're using these in an appropriate way, and that's what Rector is suggesting.
Going off of what Marina said about Rector's argument, we asked ourselves, what would Rector think of our definition? So we said that really just in relation to the definition of poverty as, a lack of resources for food, clothing, shelter, and utilities, and healthcare, Rector would most likely have a nuanced perspective, just given the readings that we've read over the past week. While he would agree that the lack of these essential resources constitutes poverty, we think that he would argue that it's also essential to recognize the broader context and living condition of those classified as poor, just like Marina said.
So what we don't like and what we like about Rector's argument. So starting what we don't like, while Rector's initial definition and argument recognizes the lack of resources affects quality of life, it may fail to adequately account for how poverty limits individuals' capacities to achieve their potential. We believe that the definition of poverty needs to show how poverty is preventing people from having the best quality of life that they can, and especially while reading Allison's memoir and discussing it in class, we saw the correlation between poverty and quality of life, and Rector's argument does not address this to the fullest potential. And what we like about Rector's argument is that Rector understands it is most important to focus on those who need the resources the most. Again, going off of the example I used before, some may be in poverty, but they have items like an Xbox or a fridge and other non-necessities. But we believe these resources from, the government or other places should be focused on the people that need it the most. And if one has these resources, they should be using them in an appropriate way. And resources should not be wasted if someone is going to use them in a wasteful way. So people should think about the best ways to use their resources.
Overall, we think that the topic of poverty is a subject that is extremely complex, and that no one truly has found a way to fix this for the world or define this in a manner that everyone agrees with.
We think this project has enabled us to a greater understanding on topics like income thresholds and capabilities and functionings. We believe the best way to define poverty would be a lack of resources for FCSU and healthcare, which directly impacts an individual's quality of life and overall well-being.